Hi, this is Gunmeet Bajaj, and I will be presenting our work titled Knowledge-Driven Drug Use Named Entity Recognition with Distant Supervision. This work is a joint collaboration between The Ohio State University and University of South Carolina. In 2019, nearly 50,000 people in the United States died from opioid-involved overdoses. The misuse of and abuse and addiction to prescription drugs is a serious national crisis. This crisis affects public health as well as social and economic welfare. The CDC estimates that over $78 billion are spent each year to address the effects of prescription opioids misuse. This number includes the cost of healthcare, loss of productivity, addiction treatment, and criminal justice involvement. This crisis has only gotten worse since the global pandemic. Therefore, it is important to study the trends of drug misuse and abuse to help halt this crisis and to prevent further deaths. To this extent, the Ohio Substance Abuse Monitoring Network, consisting of 8 regional epidemiologists, conducts surveys and studies to monitor drug abuse trends. These reports provide qualitative and quantitative information about drug use trends and are published every 6 months. There is one report for each region. All reports have the same format and are about 20 pages in length. 320 reports get published every year from the network. These reports are intended to help provide information for policymakers to allocate resources to curb drug abuse. However, given the information overload, it can be quite tedious to summarize and extract relevant content for decision making. Given the importance of these epidemiology reports, we investigate if it is possible to extract specific entity mentions from the text to reduce the cognitive overload of readers and to provide quick retrieval of facts for policymakers. The named entity recognition task from natural language processing does exactly this. It takes unstructured textual data and identifies specific entity types such as organizations, location, dates, and quantities. This task assists information retrieval processes and can help with downstream tasks related to information extraction and population of knowledge graphs. Current named entity models are designed to capture generic entities such as organization, locations, and dates. While these entities are useful for automatically extracting information from general text, they are not sufficient enough and incomplete for the healthcare domain. Recent models developed for healthcare have focused on extracting information from electronic healthcare records and are insufficient for extracting information from epidemiology reports. Consider the example on this slide. The current named entity recognition model applied to a paragraph from an epidemiology report does not capture relevant entities such as black tar heroin, and 1/10 gram. Additionally, there are several false positives that are identified from the current named entity recognition model. Given these limitations, we can see that it is important to develop an epidemiology named entity recognition model that can extract entities relevant to drug abuse trends. In this work, we develop a semi-supervised, domain-specific named entity recognition model to combat the limitations of current named entity recognition models. Our approach consists of 2 parts. The first part of our approach assigns generic named entity labels and domain-specific entity labels from a drug abuse ontology to create our training data set. The second part of our approach fine-tunes a state-of-the-art transformer model that is commonly used for natural language processing tasks. Together, this creates our approach to create a domain-specific named entity recognition model that we can use to extract information from epidemiology text. We use a drug abuse ontology to identify the types of entities that are present in epidemiology reports. This drug abuse ontology, or DAO, consists of triples that capture relevant information related to drug abuse trends. This ontology is created using context from social media and from the healthcare domain. On the slide, you can see example concepts from the ontology. This ontology is extremely helpful to boost our training label data generation to train our named entity recognition model. Named entity recognition is a supervised task that requires a significant amount of label data. Labeling data for NER tasks is expensive, tedious, and requires significant human effort. To bootstrap our training process, we use two methods to label our dataset. First, we use an off-the-shelf named entity recognition tool, Spacey, to assign generic named entity labels to the epidemiology reports. Next, we use DAO to search for specific entity mentions in the text and tag them with the selected classes from the ontology. We ask a public health official to identify relevant classes to train our named entity recognition model to help identify meaningful entities for epidemiology reports. This process creates a training dataset that we can use to fine-tune our named entity recognition model. The second part of our approach is to train a domain-specific named entity recognition model. We use the state-of-the-art transformer-based language models to train a model for the epidemiology domain. These models are pre-trained using two unsupervised tasks using a large corpora. Once fine-tuned for a downstream task, these transformer-based models can achieve state-of-the-art results on several natural language processing tasks. Our training data set consists of a dataset that combines a generic named entity recognition dataset, onto-notes, and our epidemiology reports that are annotated using distance supervision through DAO. Next, we train several variants of the transformer model, including BERT, bioclinical BERT, and Bond Roberta. BERT is a generic language model. Bioclinical BERT is the BERT language model that is trained on biomedical tasks and contains entities that are more relevant to the healthcare domain. Roberta is a language model that is only trained on the masked language modeling task and is trained on a larger corpora when compared to BERT and BioBERT. On this slide, we share our experimental results. The first set of results shares the performance of the Spacey or token-to-vec model on the onto-notes dataset. This set of results serves as our baseline even though they don't tag domain-specific entities for epidemiology reports. Next, we share the results of the two best models, bioclinical BERT and Roberta Bond, on the onto-notes and epidemiology dataset. We find that the two models have very comparable results. The Roberta model achieves a slightly higher F1 score. This higher F1 score is because of the performance on the generic named entity labels. The Roberta model is trained using a larger corpus than BERT, so therefore it will do better on the generic named entity tasks. But when you compare the domain-specific label, the two models are almost comparable. These models provide hope for a domain-specific named entity recognition model that is trained using limited human supervision. In conclusion, we use a semi-supervised approach to train a domain-specific named entity recognition model that can be used to analyze drug abuse epidemiology reports. Challenges in our approach arise from the lack of training data and noise from text processing to convert the PDF versions to machine processable formats. Future work includes training different levels of named entity recognition models based on an end user's needs and named entities that are relevant to their application. Next, we would also like to focus on relation extraction to understand the relationships between the named entities tagged by our model. Relation extraction along with named entity recognition can help us populate a knowledge graph that is relevant to understanding drug abuse and help us provide a method to create this knowledge graph to model epidemiology insights about drug abuse. For any questions, suggestions, or feedback, please feel free to contact me at the email address provided on the slide.